Some people are just crazy as it is. I know people don't like when I say like some people are crazy, but y'all know some people are just crazy. Like no matter what you do, they are gonna be crazy. Like I don't know what to tell you. Everyone, I'm your fave nurse B. So today I want to talk to you all about a viewer question that I got. Before we get into the video, make sure that you consider subscribing because I give you videos on tips about CNAs, CMTs, nursing students, people who are nurses, new nurses, all of that stuff and more. Go ahead and subscribe for more videos. Also, like, comment, and subscribe on this video. And go join the Your Fave Nurse Facebook group because the party does not stop here. It goes on and on over there. I will put the link in the description box. So let's go over this question. So Brittany Bell asks, can you make a video on how to deal with negative or rude co-workers, patients, families of patients? Since I started in healthcare, I realized I speak my exact mind, but it's not good if you want to keep your job. I have come to find out. Laugh out loud. Okay, yes, I did say laugh out loud. So anywho, the first thing that you have to realize when you're dealing with anybody who is disrespectful or rude towards you or people around you in a workplace is that you are the professional. No matter what's going on, no matter what they say, no matter what they do, you are the professional and you have to remain the professional, which it's very hard to do because people can say some crazy stuff. But I don't care if you are in dietary, if you are housekeeping, or you're a nurse practitioner, or a doctor. At the end of the day, you are the professional. You are at your job. You want to keep your job. These patients and these patients' families, like either they're going to be in some facilities forever or they're going to be in facilities and they're going to come and go. So are you going to risk your job and your professionalism and your reputation for a patient who is going to be leaving in like a week? Or are you going to risk your job and your reputation for a patient that you're going to have to deal with for the whole duration of you working at that place? No, you don't want to. So always remain professional in the way that you speak and the way that you carry yourself. No matter what, some patients are going to come to you and say kind of like funny stuff, like cute little stuff, or things that are like, oh, you know, you can kiki a little bit, but don't break that. I guess like in a sense, like don't break that third wall, if you get what I'm coming from. Like it's keep it all patient nurse. Don't friend anybody on Facebook or other platforms. Like don't curse in front of your patients or their families. Like don't do things like that because you want to keep things professional. I know it gets really, really hard when you work in like long-term care because you've been dealing with family members for a long time, but at the end of the day, when it comes down to it, with a job, for the most part, they're gonna pick that family or that patient over you. Now this is a little bit different where you're dealing with co-workers, but it's the same. I know you might want to tell your business to him, her, and them over there, but at the end of the day, be professional. Just keep that in mind. People, just because you're friendly and you want to tell certain things about yourself doesn't mean that somebody's not going to go behind your back and say something to somebody else. But that's a whole nother video, yeah. That is another video. I'm going to focus more on families and patients. So number one, stay professional. Number two is that you have to develop a tough skin. Not everything is supposed to be taken personal, especially when you're dealing with patients who have dementia. But in general, these people that you're dealing with, they are sick. If they're not sick, their loved one is sick. They're in a situation that they're like the most vulnerable that they're probably going to be in their life. Like being in a hospital or being in a nursing home, that's a very, very vulnerable situation because essentially you're stripped of a lot of your possessions, your freedom, your free will in general. You're stripped by the type of diet that you want to eat, what you want to wear, what time you can eat, spending money. You're not able to do that probably as much as you want to or in the way that you want to do it, going places, going out, smoking, all these different things, having guests in and out, all those different things are being compromised when you're either in a nursing home or in some type of healthcare setting. No matter what it is, I don't care if you're at a clinic, you're limited in some type of way. So you have to have that compassion and understanding of a patient and a patient's family, and just try to see things from their perspective. Like I said, some people are just crazy as it is. I know people don't like when I say like some people are crazy, but y'all know some people are just crazy. Like no matter what you do, they are going to be crazy. Like I don't know what to tell you, but you have to develop tough skin, like I said, and do not take it personal. At the end of the day, you get to what? Clock out and go home. So just leave it there at the job and move on. You know what I'm saying? Like don't let what people say and do get to you, because one patient one day might curse you out, and then the next day she's, you know, getting all in her feelings and emotional. She's like, you know what, you're such a great nurse. Like I know that I can be this and this towards you, but you always are so kind to me. Da 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 da. Some people, they just go through, you know, tough times. Or just think about the time when you were at your sickest, or think about the time your child was at their sickest, or whatever the case may be, or a loved one. You probably were not yourself. You probably were in a totally different headspace, a totally different mind frame. So you have to really, really, really have compassion for people. I guess it's this too. Have compassion, also develop a tough skin. Like I said, don't take it personal. Just don't take it personal. The next thing is to be confident. Now, a lot of people will act a certain way towards you if they feel like they can get over on you. You know exactly what I'm talking about. People, they'll kind of see that you're really kind and chipper and happy, and they feel like, I'm telling you, it's people out there that will prey on you and feel like they can take advantage of you, and that they can, you know, kind of be slick and sly with certain things with you. Now, I know this is... I'm just telling you, some people feel like they can get one over on people because of their mannerisms that you get them, because you're being professional, you're being kind, you're being, you know, but stand your ground. If something needs to be done, this needs to be done. You need to do this or that. Ma'am, I need you to step out the room. Or ma'am, I need you to do this. So, like a patient needs their Acucheck check done. Like you say, okay, well, you're a professional. Hi, I'm your nurse for the day. I just want to let you know I need to do your Acucheck check before you go out to eat lunch. Is that okay? Or something like that. Or sometimes don't even ask. It's not necessarily that you're like forcing yourself on them, but you basically say, this is what I'm going to do. Can I have your hand? That type of thing. Not, can I give you a shower? More than likely, a lot of patients are going to say no. But if you go in the room and be like, hi, I'm your tech for the day. I got everything ready, and we're gonna do your shower in about 30 minutes, and da 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 da, or something like that. You have to be assertive and be confident. Now, at the end of the day, if your patient is like, no, 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 some people are not gonna bend. Some people, you have to convince them to do things. Some people, they're like, oh no, I really don't want to take a shower. You gotta be like, well, are you sure? Because if I don't do it today, then you won't be able to get it done for another 2 days, and I really want to make sure you're clean, and me and the nurse really want to look at your skin and make sure everything looks good. I'll make sure the room is warm, and I'll put lotion on you, get you smelling good, get you some nice clean clothes, and then you can relax for the rest of the night. It'll take me about 15 to 20 minutes, okay? Like, you have to, I mean, because at the end of the day, you coming in trying to do something to somebody, touch them. You have to get, it's kind of how you have to give and take from your patients, and you have to, of course, build that rapport with them. But then you also have to, like I said, be assertive and be confident that you can do it. If you go in there timid, like, I just want to, they're gonna pick up on that and be like, you ain't about to do nothing to me. You're not gonna touch me. Like, I don't want you. Who are you? The same with family members. If they ask you a question and you come off like, ooh, like, I'm not sure. I just say, you know what? I'm not sure, but let me go ask somebody. I'm gonna find out for you. Boom. It doesn't have to be too airy and flittery type of thing. Just be confident. If you know what you know, let them know you know what you know. If you don't, say, I don't know. Like, ask for help. There's nothing wrong with asking for help. So that's my next tip, is at the end of the day, when you are dealing with a patient that's aggressive, that's assertive, that's not necessarily assertive but aggressive towards you, or saying like racial, like you get this a lot with patients, they're either like saying racial things towards you or sexist things towards you, or they're being aggressive physically towards you. You need to ask for help. Whether it be like, it's times where I was a CNA and I had like patients that would be like, you monkey, get away from me. That's how they be, and they're demented at the end of the day. Like, I mean, this probably how they really feel. Like, they feel like we monkeys, probably, for real, anyways. But like, if she really was like screaming and going off on me and like did not want me taking care of her, I would try my best to find one of my white co-workers few and far between, I'm be honest. But find one of them and be like, hey, can you just help me with her? Like, she's really upset. I don't want to make her even more upset because of my skin color. Can you help us out? And usually she'll do it, and he or she will do it, and I'll go and help them on one of their patients, that type of thing. Or it could be that you have a patient that's like really physically aggressive towards you, and you have to be like, I need your help, come help me. Like, because at the end of the day, you might think that working with some patients, they're weak and fragile, but I've heard about people like really having like severe health issues because patients have like messed them up like bad. I've seen patients do some crazy stuff to people, and I might do a video like about certain scenarios that might happen with patients that are kind of aggressive or rude or things like that, negative, or family members as well. So yeah, you have to be confident, but when it comes down to it, if you need help, ask for help, because that's part of being professional as well. If you need help, you're gonna have to ask for help. Like, don't think like, oh, it's weak of me to not get it. Or if you're trying to do something on a patient, like say for instance you're trying to do like an IV and it's just not working, and the patient is like, okay girl, like this is like your third IV, I'm not gonna keep letting you do this to me. If it comes down to it, ask another nurse in the facility, or you might have to get an IV. Like at my facility, we can call out and get an IV nurse to come into the facility and do the procedure. You might have to do that and just cut your losses and just do it, like, because it's all about the patient. So if that patient is, their confidence level is going low for you, like they're losing the confidence in you, they're losing they're gonna eventually lose respect for you, and they're not gonna be able to trust you. And you getting trust from your patients is like gold. Being able to gain their trust and maintain their trust is gold. The same with family members, because like I said, this is the most vulnerable part of their lives, and they need to know that whomever is taking care of them knows what the hell they doing. Okay, so like I said, ask for help. And then the next tip would be to give your patients time. Sometimes they might have heard some bad news, they might be in a bad headspace, they might be confused, they might be uncomfortable physically. At that time, if it's just you're trying to do something and they're just like, oh, it just depends on the demographic that you're working with, as far as if you're working with elderly patients, demented patients, younger patients, people who are requiring like acute care, new admissions, new to the facility, things like that. You're gonna have different patients, but if you just, like with demented patients, sometimes you have to just walk away for a minute. Walk away, come back. They're going to probably think you're a totally different person, I'm telling you. And you just come back with a different demeanor, you know, talk to them nice and sweet, things like that. And then more than likely, you're going to get what you want out of that patient to be able to care for them. And like I said, you have to sometimes give people time because they're trying to do what they have to do. I have had patients who, they're in their room like doing their taxes, and I'm in there trying to do this and the third, and they're like, okay, look, like I got something I got to do. I don't need you up in here like trying to get my freaking blood sugar. Like, can I finish this real quick and then I'll come back? Or they're on the phone taking care of business. So you have to give your patients time as well, space and time. If you're dealing with like geriatric patients or patients that you see on a daily basis, you can learn to anticipate your patient's needs. So if you start to know your patients, or if you know certain people, like for instance, it's just sometimes once you start working with more and more people, like you just get a vibe from them and be like, oh, this person is gonna probably be a handful, or she's gonna be pretty chill, okay, or you kind of get an idea of how your patient's gonna be. Like I'm just telling you over time. But if you know your patients, you might know, okay, at this time she typically is going to be in pain, or I need to make sure I give her something for pain before I try to do this treatment. And that's the case with any patient. So if you have a totally brand new patient, you might just go in and be like, you know what, do you usually have pain when we do your wound change? I really want to try to give you something like 30 minutes before I do it, just so that you're more relaxed and calm. Pain is a serious issue, okay? So definitely make sure that you are taking care of that. I know this video is kind of all over the place because, like I said, it changes when you're dealing with different demographics, but it pretty much is all the same in that you have to cater to that client, and you have to understand, okay, they are, like I said, they are in a very vulnerable state, and I really want you all to realize that and understand that and grow compassion with that. They are in a very vulnerable state. Like, just think about, like I said, anytime that you've been hospitalized or a loved one has been hospitalized, I grew even more compassion after having my daughter, just being in that, you know, hospital setting, and just everything just being all over the place, and just being very, very vulnerable. Having a child is extremely vulnerable. And just thinking like, wow, like, okay, this is showing me like I could be a better nurse, because now I have a better perspective of how it is to be in that patient role, because I really haven't had that before. I really haven't had, I've been relatively healthy my whole life, so I haven't had to be hospitalized or anything like that. So anyways, anticipate your patient's needs is going to be very important, because you can do things before it escalates. So some patients, if you see their call light has been on for a while, you can go in there before you leave, ask them, is there anything else I can do for you? I know it might seem like it's going to take up a lot of time, but if you can just say that, they will feel so much better. And I'll talk about this in another video too, but they will feel so much better, just like, oh, okay, like she really looking out for me. Like, no, it's something you could do right now, but thank you so much. Like that already like plants the seed of them feeling good about the process, because I'm telling you, nobody wants to be stuck up in a nursing home, up in a hospital, up in a clinic, anywhere. Nobody wants to do none of that. They don't. People want to be healthy, happy, and living their lives, okay? So you have to just have that compassion and have that anticipate your patient's needs as much as possible. Whether it be, like I said, giving pain medications, offering like water or food or things like that, offering to do things like in the room, like, oh, let me give you your call, like, let me move this closer to you, do you need to use the restroom, things like that. So yes, the next one is sometimes patients just want to rant. They just want to, and family members as well. I haven't really touched on family members that much, but family members, sometimes they just want to have somebody to bitch at, which is nothing wrong with. Sometimes people, they just want to have somebody to rant to. It may have not been you. It might have been the 3 or 4 different nurses that they had to talk to before you about the same freaking issue, or that they talked to 3 or 4 other CNAs about the same thing, and then it's just like, okay, like, why has nothing happened? And they are upset. At that point, this is what you do. You say, I am sorry. I'm sorry. This is what I'm going to do. And you better do it. You better, whatever it is, you better do it. And then after you're done doing it, like, okay, this is what I did, and this is what I was told by such and such and such and such. You'll be able to have this on this day. I made a note in the nurse's note just so everyone knows. I put it over here so everyone knows. Like, make sure that if you or the 5th person talking to it, make sure the buck stops with you, because it's so aggravating. Just think about it. If you coming in every day and, you know, you say that you want your mom to have on a sweater every day, and every day you coming in, and this person, your mom, has on a tank top, and she's clearly cold, and you told 3 or 4 different nurses or CNAs, I want my mom to have a sweater on. Why aren't y'all doing it? Okay, you would be upset. I mean, even though it's something small like that, but to that patient and to that patient's family is big, okay? So whatever you gotta do, put a sign and put it on the wall. If you have to tell your CNAs, tell your nurses, like, hey, look, I know you don't have this patient, but whenever you all see her, please make sure whoever has her puts a sweater on her. Something as simple as that. And a lot of times, at least in nursing homes, it's simple things like that. Take out my father's dentures at night and clean them. Like, I mean, really? We should all be doing that. Somebody got dentures, take them out and clean them. Like, that's gross. Like, clean my mom's nails. I'm big about nails and shaving. Like, I don't want my nails dirty. So I definitely look at my patient's nails and be like, let me clean these nails. Give me like 5-10 minutes to clean somebody's nail, because sometimes it be a mess. But like I said, sometimes people just want to rant, and they just need somebody to talk to. The same with your patients. And just sit there and listen to them, and then afterwards be like, you know, what can I do for you? Is there anything that I can do? And you don't have to be like, I don't know why the nurse didn't do that. I don't know what her problem is. Yeah, I don't know. You don't do that. At the end of the day, they don't care if you did it or the nurse. They don't care. They just want it to be taken care of. So take responsibility, even though you know that the nurse before you is a lazy nurse. She is that nurse. Even though she's a lazy nurse or he's a lazy nurse, do not bash them. Be professional and just take care of your patient and take care of your client and their client's family, okay? And then, like I said, adding to that is listen and then ask for what they want you to do. Ask, you know, or just go from there. Now, I'm gonna tell you, like I said, kind of somewhere in the beginning, you're not gonna be able to please everyone. At the end of the day, some people are ignorant, they're mean-spirited, they're nasty, they just hate themselves, they hate their life, they haven't had a hard life their whole life, and they don't care. They're gonna talk to you any type of way. They're gonna look down on you. You a what? You know, it's just you're not gonna be able to please and take care of everyone. But if you could follow these steps, it could really, really help you. And like I said, at the end of the day, sometimes my husband told me a long time ago, why are you getting upset, or why are you this? At the end of the day, you get to clock out and go home. It's true. And if you don't like it, if you don't want to be at that place no more, leave. I said it before in other videos. There is plenty of places to get a job as a CNA, as a nurse. And what I'm learning though is in our Facebook group, we've been talking about it, is that sometimes in some areas they are having like some scarcity as far as like jobs for CNAs and nurses, which, oh my gosh, I'm like, it seems like there's so many jobs out here for CNAs and nurses. But anywho, more than likely, wherever you're at, you will have some type of choice as to, do you want to stay at that job or not? I'm telling you, put your resume on Indeed. You will get probably a job by the end of the freaking day. Like, seriously, I've seen it. I've had it happen to me. People are always emailing me about a job. So, and sometimes you got to realize that maybe this is not the field that you need to be in. But, yeah, those are my tips for you all. When it comes down to certain things, like, you just have to temper your mouth. I know it's hard. It's hard. Some people it's harder than others. Like me, I can internalize things and just be like, okay, whatever. Let it roll off my back. But some people, their first response is just to be like, what you say to them? You got to work on it, okay? Practice it with your friends and family, okay? So those are my tips. I hope it was helpful for you all. Let me know if you have any more questions. Like, I love answering viewers' questions. Make sure that you join the Your Fave Nurse Facebook group. I want to ask you all, have you had any issues with patients? Like, how has it been? Let me know in the comment section some scenarios that has been going on, and I will do a second video about some scenarios that I've gone through, just so you can all get an idea of like some of the crazy stuff that can happen. But at the end of the day, be professional and know that you are the professional, okay? You have to be that constant throughout all this fluctuation for your patients. Your patients are fluctuating, whether it's their care, their pain level, their vital signs. They're fluctuating with their home life. Things are changing with just how they feel, with the environment. All of that, you have to be that constant for that patient, okay? You can't come in and be happy one day and mad the next day. Like, you have to be that constant. And the thing that's going to keep you constant is being professional, okay? All right. I know you somebody's favorite nurse or CNA out there. I know y'all out there. All right, y'all. Thanks for watching. Peace. Remember to subscribe.